Especially for middle-aged and elderly people, frequent cramps must raise suspicion of vascular issues. What muscle in the calf is cramping, and why does this occur? Today, let's explore this together. First, let me help you identify the culprit, the gastrocnemius muscle that causes you to suffer intensely from cramps in your calves. This muscle has three heads. The medial head and the lateral head of the gastrocnemius are the two visible ones. If I hide the lateral head, you can still see a flat muscle, which is called the soleus. These three heads ultimately converge into a single Achilles tendon, which you can feel at the back of your heel as a thick cord. This tendon attaches to the calcaneus. So what functions does the gastrocnemius muscle have? Let me demonstrate. Its first function is to flex the knee joint. Next, let's look at the second function, which is to perform ankle plantar flexion. This is the action of plantar flexion, meaning that we tightly push our foot down, which is called plantar flexion. It is pulled upward by the gastrocnemius muscle to perform this action. In fact, during a cramp, you can see your foot in this position, and there is a bulge on the back of the calf. This bulge is actually the contraction of the gastrocnemius muscle belly, forming a tight mass. It is an abnormal muscle contraction. So, what causes these cramps? Many people immediately think of calcium deficiency when considering cramps. The causes of cramps are actually numerous, and calcium deficiency is just one of them. The issues surrounding cramps can differ by age group. For example, during adolescence or rapid growth spurts, or during pregnancy, when there is a high demand for calcium, it can lead to decreased calcium levels in adolescents or pregnant women. This is a common reason, calcium deficiency. When calcium is deficient, it makes the muscles more sensitive, resulting in cramps. Which other age group may experience calcium loss? Consider women in menopause or perimenopause. Changes in hormone levels can affect their calcium metabolism, leading to potential calcium deficiency. Therefore, when considering cramps in adolescents, pregnant women, or women going through menopause, we may think of calcium deficiency as a cause. What other factors could cause cramps? There are many. For example, athletes or anyone engaging in intense exercise may experience muscle fatigue, leading to the accumulation of metabolic byproducts, such as lactic acid around the muscles. This lactic acid can also cause muscle cramps. This relates to a second possible factor: excessive exercise causing muscle fatigue compounded with the accumulation of metabolic byproducts can lead to cramps. Hence, we often recommend that athletes or those engaging in sudden exercise should soak their feet or apply heat, as the purpose of heat is to accelerate blood circulation around the muscles to remove these metabolic byproducts. A third common factor is cold exposure. For instance, in summer, if you sleep with your legs exposed and the air conditioning blows directly on your calves, it can cause them to cool down, leading to blood vessel constriction, which affects blood supply to the area and results in cramps. These are three common causes we discuss. What other reasons might there be? Particularly for middle-aged and elderly individuals who have issues such as high blood lipids or blood sugar, if they frequently experience cramps, we must be vigilant about potential vascular or neurological problems. Returning to the earlier model, when analyzing vascular causes for these individuals with long-standing metabolic diseases, such as high blood lipids or sugars, especially if they smoke, a sudden increase in the frequency of cramps might indicate vascular issues. Primarily, we consider vascular factors. For those with metabolic diseases, high blood lipids can lead to arterial wall thickening or conditions like venous thrombosis or obstruction in the lower limbs. For instance, if nerves are affected by thrombosis or arterial thickening, it can lead to insufficient blood supply to the muscles, which may cause cramps. In this case, cramps would signal that the body is in distress. While we may not realize that there is blockage, the cramps may be a result of it. If cramps occur alongside a history of high blood lipids or sugar and poor vascular health, one should be alert to the possibility of lower limb vascular obstruction leading to ischemia and should promptly consult a doctor to rule out dangerous factors. When middle-aged and elderly individuals experience frequent cramps, we should be wary of potential vascular causes. What about neurological factors? This is also understandable because leg movement relies on nerves. The primary nerves in the calf are the sciatic nerve and tibial nerve. When problems arise, such as nerve damage from high blood sugar due to metabolic diseases, it can also affect muscle movement. Moreover, issues in the lumbar or shoulder region might irritate these nerves, potentially leading to cramps. There are also central nervous system issues that could trigger cramps. Thus, there are numerous factors that can cause cramps. Deficiency of calcium is not the only explanation. Depending on age, physiological state, and overall health, we should consider various factors rather than only focusing on a single cause. Particularly for middle-aged and elderly individuals who experience frequent cramps, it is crucial to be vigilant about potential vascular issues.